So how do you do shade matching now? Example, patient comes to you. What is the first thing you do? Ask the patient to smile. First step in shade matching. This you will do even before you do anything. You should not give LA. You should not place rubber dam. Then you should not do shade matching. You should do it even before you start the case. Okay? Ask the patient to smile. When the patient smiles, look at the smile. And when you look at the smile, you look at their teeth. Now the moment I look at the smile, what do you feel? Is it looking bright to your eyes? Dark or medium?
Bright.
How many for bright? Bright, see? Majority. It's bright. It's bright for a simple reason, because she's young. And even more because she's a female patient. So if you have a female patient who is young, the teeth are more brighter when comparatively to a male who is a young patient. Is it very clear? First step. You do anything, you do composite, you do ceramic. This is the first step of shade matching. Ask them to smile. Okay? Now you write on a paper, value high. Just write. Because eyes, just by seeing the teeth, it will not tell it's A1 or B1. Are you getting my point? Eyes and mind is synchronizing and it is telling, okay, this object is bright. That's all eyes can do. Okay? So you write it down. After this step, you go back to the second step, and what you do is you take a cheek retractor, and now I need to know the hue of my patient. So second step, put the cheek retractor, ask the patient to roll the tongue, because the teeth have to be wet. Never do color selection dry. Many people do that mistake. They take 3-way syringe, they dry the tooth and then look for shade. Remember, our patients with our restorations are not dry, they're always wet. With saliva, you need to simulate that. Otherwise you will go wrong. Eyes will deceive you, okay? Don't do that. So what I do, second step, cheek retractor, ask the patient to roll the tongue. And now I need to know what my patient's hue is. So now the question is, which part of the tooth will I look at to get my hue? Is it incisal, middle or cervical? I already gave you the answer before. Which part of the tooth? Huh? You'll see middle. Incisal and middle for hue. Okay? All of you agree to that? Incisal. Why incisal? For hue?
Visible during smile.
Okay. It is not incisal. I want to know the color, basic color of my patient's tooth. It's not value. Huh? Cervical. I already told you, where is dentine thick?
The cervical area.
Wherever you see more dentine, that part only will tell you the correct hue. If you see incisal, there is no dentine. There is almost dentine is only 0.3. What is more? Enamel is more. So you see more translucency. So please, whether you want to know whether your patient is A, B, C or D, you need to check their cervical third. Cervical third will give you the right hue. So when I look at the cervical third, and if my eyes can see a little bit of brown, you'll see a little bit of brownish tinge, red brown, red orange, it's A. If it is white or yellowish white, it is B. If you see grey, it is C. If you see reddish grey, it is D. Is it very clear? So now I know my patient's value is high. I know my patient's hue is A. What is my next step? Now I need to know the chroma. So what is chroma? Chroma is the numbers. Number. Chroma is not alphabet. Chroma is the number of that alphabet. So if my hue was A, it was brown, I need to know whether my patient is light brown or dark brown, in which areas. So meaning to say every alphabet has a number. Have you noticed that in Vita Pan Classic? A1, A2, A3, A3.5, A4, correct? A4, A3.5. Can you see the brown here? It's quite intense. See? It's quite intense. See the brown here. See the brown here. See what is happening as I go towards 1. The brown keeps reducing and the brown keeps increasing here. So who will have an A3.5 chroma? Older patients, absolutely. And who will have a low chroma? Younger patients. So now it's very simple. My value was high, my patient was A, my patient is young, that means my shade is A1. Simple logic. Are you getting my point? My value is medium, for example, my patient is A, my patient is adult, it's A2. A2 is not for everybody. You can't give an A2 to a young patient, it will not look nice. For example, my value is low, my patient is A, my patient is old, A3 or A3.5. Of course, the hue can change. So if my hue is B, then if my value is high, then it is B1. If my hue is B, value is medium, then it is B2. If my hue is B, value is low, then it is B3. Is it very clear? This is exactly how you go about shade matching. So you need to train your eyes. You need to keep looking at teeth every day. Whatever procedure you do, please keep looking at the teeth and do this exercise in your mind. You will never go wrong. Is it very clear? And then once you have made up your mind, then you get your shade tab just to see whether what your mind and eyes is seeing is the shade tab seeing or not. Finally, I get my shade tab only if I am doing ceramic. But if I am doing composite, I don't do that. What I do with composite is you need to do something called as button technique. So I already showed you, yeah. This is called the button technique. Can all of you see this? Without etching or bonding, once you have done your shade matching exercise, if you have selected a particular composite from your syringe, take a little bit of composite, place it on the tooth in question, no etching, no bonding. You're not etching, you're not bonding, but place a button, okay? Place a button and light cure it. And then check, ask the patient to, and check whether it is matching to the existing tooth. This is 100% shade matching. You will never go wrong because you're using the same material as a final material for your patient. Is it very clear? This is called button try technique. So if you want to check the value, you convert that into a black and white. You could do this on your smartphone. Value can only be measured in black and white image. It cannot be assessed in color image. But if you are seeing hue and chroma, then you do it in color image. Is it very clear? There are many of them who do this, but they do not light cure. You know that? They place composite, they do not light cure. They see, it is matching. And then they start using, and then they will land up in problem. Why? Why should you light cure? And why many people don't light cure? Because they want to save that little bit of composite so that they can use that as a first increment. That is not correct. Please light cure. Because if you do not light cure, composite will not show its true color. Because there is something called as camphoroquinone in the composite. Every composite has a photo initiator, correct? Which initiates the curing. The camphoroquinone based composite, it gets a little darker after curing. Okay, but if you are using Evoclar composite like Evoclar Viva Dent, they are not based on camphoroquinone, they are based on evocerin. So they get a shade lighter, okay? But all other composites in the market are based on camphoroquinone. So please light cure them and then analyze the shade. Is it very clear? Okay? Okay. Any questions still here? Hue, value, chroma, all clear? 3 steps. Now let's go to the 4th step. So this is exactly how I do. That's my button technique. You see? Now tell me what is changing here from here to here. I have placed the button at the incisal edge, correct? Why I have placed the button at the incisal edge? Because I want to check for value. Out of the 3 buttons, which is high value? On your extreme left.
Left.
This is low value, this is medium, correct? When I want to check the hue, I am going to place it on the top. just to check whether, see, these are all brown. So this is A3, A2, A1. Can you see that? So I want to see what shade of hue is my patient. And you will never go wrong. Okay? So please do this for all your composite veneer cases, class 4 angle build-up cases. It's very critical. For class 3, class 5, I don't do all this because aesthetically they are not in a very important location. I can get away with only one shade. But when I'm doing veneers or class 4, I need to use multiple shades. I need to vary my thickness of my composite when I'm layering. Okay? Now we go to the fourth step. What is the final step of shade matching? Translucency. How many of you see translucency in your patient's teeth? Have you observed translucency? Very, very important. You need to read these patterns. Every patient has a pattern. And I'm going to show you there are 4 different patterns which we see. Let's look at type 1. What is a type 1 pattern? Let's look at this tooth. This is a real patient's tooth. See the central incisor. Now what do you see? Type 1 is very simple. The translucency pattern starts from one proximal, penetrates the mammalions, and ends on the other proximal. Can you see that? This you will see a lot in young female patients. A lot. Why is this important? Imagine your patient comes with a fracture. You want to build it with composite. You get all the colors right, but you fail to give this pattern. Believe me, this restoration will look dead, especially in young patients. Patient will say, oh, it's nice, but I'm not very happy with the outcome, because you have missed on the translucency pattern. Is it very clear? This is type 1. Okay, I will show you in the demo how to give this. Nowadays with a lot of composites available, translucent composites also are available, you could do all this in your patient. Okay, let's look at type 2. This is type 2. Not very common, but it's exactly opposite that of type 1. The translucency pattern is only present parallel to the incisal edge, like a straight line, that's all. It is not penetrating the mammalion, it is not starting from the proximal. Is it very clear? It's just like a straight line parallel to the incisal edge, in the middle third of the incisal edge. Very common in male patients. This is not seen in females. Let's look at type 3 now. This is very, very common, at least in our population, Indian population. We did a study, we published this paper. So what we found was type 3 is basically only proximal translucency. Only proximal translucency. Mesial and distal. Nothing at the edge. Nothing at the edge. So you see patients having translucency only in the proximals. Okay? Very common. You might also see this here. So what you have to do is, whatever you do from tomorrow, whether you do oral prophylaxis, extraction, any procedure in dentistry you do on your patients, keep looking at teeth, keep reading so you know exactly what you're seeing. Okay? So this is the information you need to gather. And now let's look at type 4. Type 4 is a mixed pattern. It's a very interesting pattern, very common in our population as well. There is no definite translucency pattern, okay? But it comes with a characteristic white spot. Have you seen some patients having white spot? See there, white spot with some translucency. White spot, translucency. Very, very common. This is type 4. So if your patient has the translucency patterns, you have to mimic them. You have to mimic them. And we published this paper in Quintessence, and we got type 4 was the most common, followed by type 3, then type 1 and type 2. You see, type 4 was 34%, type 3 was 33%, type 1 was 17.5%, and type 2 was 15%. So now you need to figure out what you are getting in your patients. This is a very good study to do in any university, very easy. You just need subjects, 200 subjects. You need a good DSLR with macro lens, and you can map these patterns in a software. Okay. We have very few papers published on this subject. Is it very clear? Yes, please.
The age of the population for this study.
We checked for about 16 years to 40.
So you said that it depends on the age
It
of
is
the
directly related to age. Very good. Yes.
So,
Above 45, they tend to lose the translucency pattern as they age. Okay, so translucency pattern is usually seen between 16 to 40, more between 16 to 30. Okay, and 30 to 40 you will see very, very less prominent. But in younger patients, you see a lot of these patterns.
type 4 also.
Pardon?
Type 4 also.
Type 4 also, yes. Usually type 4 is seen more in males when compared to females. But females, we saw a lot of type 1. Okay, type 1 is very common, and type 3.
More young, more translucent.
Absolutely, absolutely, absolutely. So when you do a ceramic veneer, for example, Emax porcelain veneer, you need to communicate this pattern to your technician. If you just tell him A2, he will paint A2 from top to bottom and send it to you. It will look very opaque. It will not be aesthetic. So you have to give him a prescription. You tell him, I want this pattern like this. Draw and send it to him. He will give patterns. And with Emax and any kind of composite, the moment you give these translucency patterns, your aesthetic level of the restoration goes to the next level. Okay? So this is extremely important.